The heart is the most important organ of the body, and it is made up of two collecting chambers on left side and the right side, and two squeezing chambers, that these are the pumping chambers, both one on the left side and one on the right side. Now this squeezing chamber, the pumping chamber on the left side, is sending blood into the whole body, which is carrying oxygen and nutrients to the vital organs. The right ventricle, which is the squeezing chamber on the right side, is collecting the impure blood from the body and sending it away into the lungs for purification, from where it comes back into the left side. So this circuit keeps going on, and these four chambers are separated from each other by valves. These are four valves which make sure that the blood is only flowing in one direction and not going in the reverse direction. Now the most important function of the heart is to continuously beat nearly 70 times in a minute. So for continuous working, the heart itself needs oxygen and food. So this is supplied to the heart by three pipes, or these are called coronary arteries, one in the front, one on the right side, and one on the left side. So these coronary arteries are carrying oxygen and blood to supply to the heart muscle so that it can continuously work throughout your life. What is a heart attack? Now we talked about three coronary arteries. These are the pipes which are carrying oxygen and blood into the heart muscle. When the lining, inside lining of these pipes gets cracks due to any reason over a period of time, the cholesterol which is circulating in the blood will stick into these cracks and enter them and start accumulating over there, and then there is a reaction where this buildup, which is called a plaque, forms in that point, and slowly over a period of time this point starts obstructing the flow of blood into the pipe. So that area of the heart muscle is not getting adequate blood supply. Now suddenly what can happen is that this blood which is not flowing freely will suddenly thicken and form a clot and clog that narrowed portion completely. So what is happening now is the distal portion of the heart is suddenly not getting oxygen and blood, and this is what results in the heart attack. So when a person has a heart attack, he will feel extreme pain, which is like a very heavy weight has been put on his chest. This can radiate into the jaws, into the shoulders, into the arms. At the same time, he will have extreme ghabrahat and sweating, and at times people can faint also. All chest pains are not due to the heart. It's very important for us to understand. A typical classical angina is some kind of a oppressive feeling on your center of the chest, which can radiate into the jaws, go into your shoulders, go into the arms and the hands, and sometimes they can come into the middle of the lower part of the chest. So this is the region where you will feel pain due to the heart. But most importantly, this pain has to be related to exertion, either when you're walking fast or when you're climbing up stairs or you're running, and then you start feeling these symptoms, and these symptoms have to go away when you stop walking, when you stop climbing the stairs. So this is very typical of angina. Now if a person has pain in the chest for several days, which is increasing when you press on that particular portion of the chest, that is not due to a heart angina or a heart attack. So one thing is the location of the pain, second thing is the relation of the pain to exertion, excitement, or some kind of an extreme anxiety, and third thing is the pain has to subside when you have stopped exerting, or when your anxiety or excitement has subsided down. That is what should be taken as cardiac angina. Heart attack is not the only problem which affects the heart. As we know, the heart is made up of pumping chambers, it is made up of valves, it is also made up of coronary arteries which are supplying blood and oxygen to the heart itself, and in addition to this, the fourth thing in the heart is the electrical wiring of the heart. So electrical wiring is responsible for carrying the heartbeat throughout the heart. So there can be a disease of any of these components. It can be a disease of the coronary arteries, they can get blocked with cholesterol, as we have discussed earlier. The valves of the heart can get diseased, and they can either shrink so that they don't allow free passage of blood through the heart, or they can start leaking due to damage, so that the blood which is flowing forward is also leaking back into the upper chamber and flooding the heart. Then you can also have weakness of the heart muscle due to a heart attack earlier, or due to any viral infections, or due to many other diseases, so that ultimately the heart is not effectively able to pump blood forward, and slowly the heart enlarges, which is the term for which we use is heart failure. And finally, we can also have diseases of the electrical system of the heart, where the electrical wirings, there are three main wires in the heart, they can slowly over a period of time or due to disease get cracks, and they stop conducting heartbeat forward, so that if the heartbeat is not traveling in the heart, then the heart will suddenly stop and come to a standstill. So these are situations where you may have to give a pacemaker to restart to make sure that the heartbeat is traveling into different portions of the heart. So it is not only the heart attack, but the heart has so many other structures, and any of them can get diseased, and so we can see patients with different kinds of heart problems. Very much possible for a person to lead an absolutely normal life after having a heart problem, because today the technology has advanced in such a manner that we are able to take care of most of the heart problems, unless the person comes in a very extremely advanced disease state which has gone beyond repair. If there are blockages in the heart arteries, these blockages, if there are 2 or 3 blockages, they can be easily cleaned by a procedure called angioplasty and stenting. Or if the blockages in the coronary arteries are very diffuse, then a procedure, surgical procedure called a bypass surgery can be offered to these patients. Once these procedures are done, we are able to ensure absolutely normal blood flow into the heart, and the heart can continue to work in a healthy manner, so the person goes back to a normal life. Supposing his valves are diseased, either they are shrunken or they are leaking, these valves can be changed surgically, or at times we have now new procedures where without surgery we are able to change these valves. And thirdly, if there is a disease of the electrical conduction system of the heart, and the wiring has cracked and the heartbeat is not traveling in the heart, we can externally implant pacemakers which can continue to give normal heartbeat to the heart, so that there is no risk of the heart stopping down. So with these problems taken care of, a human being is able to function absolutely in a normal manner. So the message to lead a healthy life and stay close to the heart is that keep your mind and body healthy. To keep your mind healthy, it is very important that you maintain the right balance between your work and your family life. It is important that you take frequent and enjoyable vacations, you take good sleep, you do good exercise, and spend enough time with your family to de-stress yourself. And to keep your body fit, it is important, of course, in addition to good exercise on a regular basis every day, you also have to see that you are eating healthy. And there are certain foods which you should make sure that you should avoid, and for which I have the 4 M's to advise you, which include malai, makhan, mithai, and mutton. So if you are staying away from these 4 M's, you will stay away from the 5th M, that is Dr. Mathur. Thank you.